We've been really interested in looking at the phosphoproteins in triple-negative breast cancers that are refractory to treatment, and have made a couple of interesting observations. One, matching the genomics with the phosphoproteins in triple negatives, for example, that have PI3 kinase mutations, which is only 9% of triple negatives, but have shown a particular phosphoprotein pattern, interestingly, not activation of the PI3 kinase pathway, but activation of the MAP kinase pathway through the epidermal growth factor receptor. And I've had a very interesting patient who had a multi-year response to an antibody against the EGFR. So that was fascinating and could really lead to a new treatment for those kinds of patients. And then secondly, this patient with a very refractory triple negative breast cancer that had very, very high levels of the epidermal growth factor receptor phosphorylated. And then when she was treated with this investigational agent that led to unleashing of DNA repair defects, her epidermal growth factor receptor completely went away and her cancer became very sensitive to chemotherapy, and she went on to get a fantastic durable response from chemotherapy. So that epidermal growth factor receptor, just really strongly positive, was making her cancer highly chemotherapy refractory. And there's some novel ways now to potentially get that out of the way and make the cancer more sensitive now to chemotherapy. So that's been very, very interesting. And it really has taken a bit of sleuth work, to get some hypotheses now that would be useful possibly for other patients in clinical trials.